Hello, everybody. Good morning to those of you who are joining us from the West Coast. Good afternoon to everybody else. Thank you so much for joining us for this webinar that accompanies the release of a report from MPI's National Center on Immigrant Integration Policy titled Serving Immigrant Families Through Two-Generation Programs, Identifying Family Needs and Responsive Program Approaches. Today you'll be hearing from Maki Park, a policy analyst with us here at the National Center on Immigrant Integration Policy, and me, Margie McHugh. I'm the director of the center. And we're also joined by our third co-author for the report, Caitlin Katsiafikas, who's an associate policy analyst here at MPI. Before we get going, let me just review a few logistical issues. First, you can see there on the screen where you'll be able to obtain slides and audio from today's webinar. You see also there the bit.ly for downloading the report. If you have any problems during accessing the webinar, please feel free. We're monitoring that events@migrationpolicy.org email address, and you can also call that number on the screen, 202-266-1929. We have people standing by, able and ready to help you with any issues that you're having. We would really appreciate it if you would use the chat function at the right of the screen to write us questions. It always helps us if you send in questions during the webinar so that we can kind of sequence questions better, group them, assign them, to who's going to answer them, that sort of thing. So please write and know that we're monitoring that the entire time. You can also send your questions to events@migrationpolicy.org, and you also can tweet your question to @migrationpolicy or hashtag MPI discuss. So moving right into the conversation about the report. Whoops, if I can get the screen to advance. There we go. So I just wanted to give a little background about the report and how we came to do it. First of all, we had been concerned for a good while that there just wasn't a lot of information out there about the ability of two-generation programs to meet the needs of immigrant and refugee families and what those specific needs actually are. So we were very grateful to have had support from the Annie E. Casey Foundation to take a closer look around the country at service models that are addressing the needs of parents and young children at the same time in hopes of more permanently lifting them out of poverty, but doing that specifically working with immigrant and refugee families. And so that's obviously one of the things we were looking at in the report, trying to take a closer look at those programs, look at the key factors in their success, and also the challenges that were facing them. As part of doing the study, Maki will talk a little bit more about this in a few minutes, but we conducted a literature and field review, socio-demographic analysis, and a series of interviews with effective programs. We also conducted a pretty detailed socio-demographic analysis using pooled American Community Survey data from the U.S. Census Bureau, because we wanted to be able to compare the characteristics of immigrants. I guess you'd say we would say just foreign-born individuals generally who are parents of young children 8 and under, and those same parent groups, those same parents who are native-born. We wanted to get a better sense of both the number and the proportion of immigrant and refugee families that comprise targets for the two-generation field for their services, and also get a sense of some of the specific traits that foreign-born individuals possess that would be relevant to the service models that two-generation programs use. So I'm going to talk a little bit now about the findings from the socio-demographic analysis, and then Maki will speak a bit more about what we found in terms of our interviews with programs around the country. I don't know why. There we go. I think I just have to press a little harder here. Okay. Sorry, having a little, there we go, a little difficulty getting up, getting the right pressure for pressing here. So in terms of the socio-demographic analysis, just a few of the major highlights that just the very top line findings. I'm going to go into much more detail in a moment. But first of all, the starting point is that immigrants make up 23% of all parents of young children ages 0 to 8 in the U.S. They are disproportionately low income and more than twice as likely to lack health insurance. So we'll talk a little bit more in a moment in particular about some of the income issues and their relevance, but primarily why we place such a focus on that is because that's one of the primary traits that the two-generation field looks at, because it is so focused on bringing families out of poverty. Poverty is the main indicator, and then of course we'll talk a little bit more about the lack of health insurance, but obviously that's another factor in terms of indicating family vulnerability. Then getting more to the specific traits of immigrant parents of young children, there's a great deal of discussion in the report about the number and share that are limited English proficient, that's what LEP stands for, and or who have low levels of education. Because such a big focus in the workforce, in the two-generation field, is trying to help families progress to a level of education and skills that would qualify them for jobs that are in more secure jobs, jobs that pay a higher wage, and that a family can really rely on for economic stability, that since that's sort of at the top of the pyramid of the sorts of services that the field is seeking to provide, we try and take a closer look at where immigrants might fall along the on their way towards those sorts of services from the field. So I hope this is large enough for you to see here, but a main highlight in the report is, well, there's a very large table in the report that includes a number of the key characteristics that are relevant for two-generation services more broadly. And as I said earlier, income and poverty are a very important indicator. So if you look here at this table, you'll see at the far left, the darker colored band represents foreign-born, lighter colored native-born. So you can see that foreign-born parents of young children who are more likely than those who are native-born to fall below 100% of the federal poverty level. That's 24 versus 15%. Then moving a bit to the right, we looked at less than 185% of the poverty level because that's a standard that's often used by the Department of Health and Human Services to determine eligibility for some of its programs. And you can see again there that foreign-born families are significantly more likely than those who are native-born to fall into that band. And then looking to the far right, that's all of those who are at or above 185% of the poverty level. And you'll see there that almost 70% of those parents native-born parents of young children fall above the 185% versus only 50% of those who are foreign-born. So as I said again, since this is really the primary indicator very, very broadly in terms of those who are targets of two-generation services, this is quite significant in terms of indicating that immigrant and refugee families would be a primary target for services in the field. So here you have the employment status, a comparison of employment status of native-born and foreign-born parents. So you'll see here looking to the left, the far left, that immigrant parents are almost as likely to be employed as their native-born peers, 70% for immigrants and 75%. So one of the things that we'll get into in a little further on, is that immigrants you just heard are disproportionately poor compared to native-born parents, and yet you see here that they're almost as likely to be employed. Then they're pretty much just as likely to be unemployed, basically 6% for each. And then at the far right there, the not in the labor market is one of the more interesting things that that the analysis turned up, and that is that, first of all, foreign-born parents are more likely, 24% versus 18%, to not be in the labor force. But then as we looked more closely at that number, it was very clear that gender differences were driving the difference between immigrant and native-born, the difference in immigrant and native-born not being in the labor force, and that it was mostly native-born, foreign-born mothers that were not in the labor force. A very big difference there, 42% versus 28% foreign-born versus native-born. And we'll return to that in a few minutes, because that's a very significant issue then in terms of what types of programs are most relevant or practical for that, particularly mothers who are not in the labor force, who are immigrant women. So next, just taking from a different table in the report, we wanted to speak on this webinar about some of the particular characteristics of immigrant and refugee parents that we looked at, because given the emphasis of the two-generation field in helping families make their way out of poverty through a variety of strategies that help build their human capital, looking at education levels and English proficiency levels is a particularly important issue then in terms of understanding appropriate program designs for immigrant and refugee parents. So if you look at the top portion of the table, you'll see that nationally 13% of the total parent population is LEP. But then going to the right, you'll see, not surprisingly, that those who are foreign-born comprise the largest share of those who are LEP, and you'll see there that that 52% of foreign-born parents of young children overall are LEP, and then just beneath that, 29% of these are considered low LEP, which means that they would need a longer period of English language instruction in order to make their way to full proficiency. Looking to educational attainment, which is another important indicator in terms of the ability, for example, to access workforce training programs, since many of those programs require a high school diploma or equivalent in order to participate. You'll see that 30% of the foreign-born, if you add these right there where I've just circled, 30% of the foreign-born have less than a high school diploma or equivalent, compared to just 6% of those who are native-born. And then you can see there's a split between those who have 0 to 8th grade education and those who have a 9th to 12th grade education. So that indicates, obviously, that additional adult education services would be required by a significant number of immigrant and refugee parents in order to make their way along the education trajectory that's needed to get up to the what most people now refer to as the middle skill job level, or the educational requirements for that. But then looking down the table, you can see also that it's basically the same percent of immigrants and native-born who hold a high school diploma or equivalent, and that there are significant shares, too, of the foreign-born who have some college education and a bachelor's degree or higher. So these are, this table begins to really paint a picture of the types of services that are more specifically needed in the case of adult English language classes, or the more generic classes, educational attainment classes having to do with getting through adult basic education, adult secondary education, that are widely offered for both, generally for folks who already have high levels of English. Talk more about that in a moment too, that very often in the country these are siloed services that the system is set up with the expectation that individuals will first learn English and then proceed through adult basic education and high school equivalency classes. So the last chunk of data that I'm going to say a little bit about is that after looking at these characteristics very broadly, we drilled down very specifically in the report on the foreign-born, low-income parent of young child population, because this truly is the population that the two-generation field would be focusing on, that these would be the prime targets for services. And so you can see here that fully 71% of those the field would aim to serve have English language learning needs. So this is maybe not, it's not so surprising, I guess, for folks to hear who are out there in the field and providing services, but I think it's a very, very important factor to have settle in about the importance of those services. And what we found all throughout our work on this report was that really is the critical threshold service for so many low-income parents who would be a focus of the field to make their way into the other services that the field seeks to provide. Then almost half have less than a high school education, and so for those of you who are in the adult education and workforce world, you know also that because of the siloed nature of services, that trying to work with parents who have both needs, both an underlying adult education need and an English language learning need, that these are often complex program models to run, and not very much, not very much available. Then if you're a frontline service provider, just looking at these next three, 27% having a high school diploma or equivalent, 16% having attended some college, and 9% having a bachelor's degree or higher, that was really one of the fascinating things that we saw as a reality facing so many of the programs that we spoke with, that you are faced literally as a service provider with the diversity that you see here on this slide in terms of the educational attainment of individuals. So meaning that you could have someone, back to back as a service provider in a local community who has some college education and may require just a little bit of additional English language training, and someone who has only a few years of formal education and also is very low LEP. And it's not, it's not the easiest thing then to set up a consistent program design and staff it that could meet this diversity of needs. So this is just a foreshadowing of some of the of what's in the report and what we then found in our field work, which Maki is going to, I'm going to turn it over to Maki to describe. But first, I want to make sure to thank our colleagues Jana Batalova and Ji Zhang from MPI's data team for their help in conducting this ACS data analysis. And then also I'd like to say, because I know some of you are already starting to ask this question, do we have the data below the national level? And so I just want to say that in about 2 weeks, we expect to be putting out fact sheets that take a lot of the data that you see in the national analysis and provide them for the 30 top states for the number of foreign-born residents. So there'll be a whole nother data trove up on our website in about 2 weeks that hopefully will be helpful in your state-level work on these issues. So with that, Maki, I'll turn it over to you.
Great, thanks, Margie. So as Margie mentioned in her description of the overall study, we set out as part of this research to identify a number of exemplary programs that have been successfully serving immigrant and refugee families. And we had a few goals going into the program selection. First, we wanted to identify programs that were using a variety of federal and local funding sources as a means of illuminating policy design issues in addition to promising program elements for immigrant families. So we looked at the major federal programs that encourage a two-generation approach, including Head Start, the Maternal and Infant Early Childhood Home Visiting Program, family literacy programs under WIOA's Adult Education Funding, Promise Neighborhoods, and full-service community school programs. We also made an effort to include programs that blend different service approaches and funding sources, which was not surprisingly the case for many two-generation programs, given the breadth of services that they seek to provide. I'll say here, too, that our definition of two-generation programs for the purposes of this study also gave us additional parameters in choosing from the vast array of programs that are available. First, we focused on programs that were serving parents alongside young children ages 0 through 8 specifically, and this was due both to the fact that a large body of research shows us that providing high-quality services in the early years is particularly impactful, and also because the provision of public services in the early years is so uneven. And two-generation programs that do offer high-quality early learning opportunities are particularly important, and especially so for immigrant families that tend to access early childhood programs at lower rates than their peers. We also limited our search to programs that do provide direct services, both to young children as well as their parents concurrently, though not necessarily in the same physical space. And then finally, in addition to trying to cover as many different funding streams and federal programs as possible, we also tried to capture diversity across a range of other factors, including geographic location, countries of origin of participants served, race and ethnicity, languages spoken, levels of education, and mode and recency of arrival for immigrant families. And you can see the list of programs chosen for interviews here, which you can read more about in the report. But you'll see represented here, as I mentioned, a range of different funding streams and program models. Aspire uses LEOA funds to provide its family literacy services. Avance, Educational Alliance, and PICA all utilize Head Start funds. PCHP and HIPPY are both home visiting models. Chula Vista is a Promised Neighborhood program, and so on. I do want to mention here also that while our interviews with these programs informed our findings and our policy recommendations, the conclusions we've drawn are, of course, not necessarily endorsed or supported directly by these programs, and they reflect only our own independent analysis. And these are some of the findings that resulted from these conversations, where people really generously offered us their honest perspectives and lessons learned from their direct experiences working to uplift immigrant families through their service offerings. First, we heard from every single program about the importance of having a diverse, culturally and linguistically competent workforce that truly reflects the community being served in their program. Having a staff that's able to speak each family's home language was really seen as indispensable, both in attracting families to programs and building trusting relationships with them that provide the starting point for their successful and full participation, and then also in terms of their ability to equitably serve LEP parents and children who are dual language learners. And this was especially true for families who are speakers of lower incidence minority languages other than Spanish. Home visiting programs were particularly likely to relate to us how important it was when their staff go out knocking on people's doors, that home visitors were immediately seen as people who could be trusted. These programs often reach those families who are the most isolated and the hardest to reach, and those who may be the most uncomfortable engaging with more traditional social services and programs. And this is a huge advantage that home visiting programs have in serving immigrant families, that they truly physically meet parents where they are, and with ambassadors who are members of their community and have in many cases experienced the same struggles that their participants have. Next, program staff also universally acknowledge the need to intentionally build the social capital of immigrant families and connect them to a wide range of local supports. Program designs all emphasize the need to reduce immigrant parents' social isolation and improve their ability to navigate local systems, whether it's their children's elementary school to engage in their child's learning and education, or their local public library in order to obtain a library card. The building of social capital and community connections was a means of providing a lasting source of resources and a social safety net that supports families' long-term integration and success. The next point, utilizing holistic needs assessment and case management approaches, came out of several remarks we heard during our interviews about the fact that families, and in particular immigrant families, come into programs with a wide array of needs and vulnerabilities. Many programs, for example, mentioned ongoing housing crises that meant that parents were unable to focus time or energy on anything other than securing an affordable place to live This simply needed to be addressed before they could proceed in engaging in any other kind of training or educational activity. So making sure that no one challenge derails a family's overall progress is crucial to make sure that they can persist and succeed in a program. And this need to understand and address multiple varied needs, even those that fall far outside of a program's central mission, is really important. Most programs relied on community partnerships in order to be able to respond to the range of immediate and long-term needs that families presented with. And identifying what family needs are was also an important best practice that we heard about from the Chula Vista Promise neighborhoods. They utilize an extensive questionnaire that places families on a spectrum of need for a long list of possible risk factors to ensure that they're linked into the services and the supports that they need. And this is part of their intake process up front at the very beginning of every family's engagement with the program. And this relates to the next point about the importance of data-driven planning. Funding processes that use data-driven planning and that allow local initiatives to then be flexible in choosing strategies to address the community needs that they identify. This supports programs in addressing gaps in services specific to immigrant families. Because immigrant and refugee settlement patterns often change quickly, engaging in this kind of planning to understand community needs and demographics, and then also having sufficient flexibility in program designs to be able to adapt services to changing needs was stated by many as being critically important. Because immigrant families have diverse needs based on levels of education, English proficiency, employment status, or immigration status, among other factors, understanding the various elements of two-generation programming that are really needed by different participant populations is critical to success. At the same time, having funding sources and program structures that can accommodate changing needs is also needed in order to be responsive to these needs. So overall, from our conversations, we heard from Promise Neighborhoods and community schools programs that their programs and funding structures were the most flexible in terms of being able to focus on strategies that are most relevant to their beneficiaries. On the flip side, we heard from Head Start programs, for example, that it's often difficult for them to steer the resources that they knew were needed by their highest need immigrant parents in their services, because Head Start is first and foremost a child-serving program, and there's less funding support provided for parent provisions. And then this final point is actually closely related to the first. Grow your own initiatives that identify and train outstanding program alumni were stated to be very successful in two really important ways. First, these types of initiatives can develop some of a program's most effective staff, who, since they are of the community being served, are really attuned to participant needs and are uniquely inspiring to the parents and families they work with. At the same time, having a Grow Your Own initiative directly empowers parents participating in programs and gives them a long-term goal to aspire to. These initiatives also provide realistic workforce training opportunities and accessible employment for individuals who might be LEP or have lower levels of education. And this is particularly important given that many folks that we interviewed talked about the challenge of hiring diverse staff with linguistic and cultural skills. PICA Head Start, for instance, told us that they for a long time relied on parent alumni of their programs as future staff, but rising requirements in the Head Start program that call for higher degrees and credentials meant that this was a practice that was no longer viable, since parents in many cases lacked formal qualifications. But recognizing that these parents were still such an important pool of motivated staff, they took it upon themselves to create a training program that provided a pathway for their parents to gain the degrees and credentials they needed to teach and work in the program. So these are just some of the top-line findings in terms of program and policy elements that they're laid out in greater detail in the report. For now, though, I want to move on to speaking about some of the key policy recommendations and implications that these findings point to. I'll be going through quickly those recommendations that are rooted mostly in the early childhood and two-generation arenas before handing back over to Margie to discuss the portion that's most focused on adult education and training needs. So first, following up on my most recent point, the linguistic and cultural competence of workers are such an important core strength of effective programs. Given the evident difficulties in maintaining and building a workforce that contains this diversity, efforts to widen the pipeline for such workers is really needed. So given the ongoing call for higher credentials that I just mentioned, there is a growing need to provide integrated pathway programs for immigrants who are currently working in and who are interested in working in early childhood and other two-generation programs. Programs like these in community colleges and other institutions of higher education provide adult education and English language classes that are contextualized with content that's required for formal degrees, along with financial and other support services to promote retention and advancement. Programs like these that immediately allow LEP and low-educated students to advance toward gaining a formal degree could significantly expand the pool of workers with language and cultural skills that are so essential to the success of many two-generation programs. The next point is about the need for clear data. Improved collection, analysis, and use of data relevant to immigrant families is needed in order to provide them more equitable access to high-quality two-generation services and ensure that service funding designs take their needs into account. And this is something that's true across early childhood and other programs, and is of course not limited to the two-generation field, but information, for example, about the dual language learner status of children and key characteristics of their parents, like home language and English language levels, these are necessary to enable analysis of equity and access and additional resource needs of programs who are serving participants with multiple challenges. And in many cases, these are data points that are not currently being collected. We found that the Federal Home Visiting Program, for example, doesn't collect data identifying foreign-born and LEP participants. But having this data could be really instrumental in revealing gaps in service access for these groups. But this is something that we can't currently know quantitatively, which is a huge disadvantage. We also heard from programs that assessment instruments, particularly for young children, are often not relevant or appropriate for dual language learners. They don't capture children's first and second language skills or include meaningful measures of program quality that are specific to this population. Having assessments that can provide us with a clear understanding of how these children, who make up such a large proportion of young children in the U.S., is key to improving services for their needs. The next point touches on the need for better language access. The Federal Administration for Children and Families, who administer Head Start and Home Visiting, among other programs, should more actively assure equitable access for LEP parents and families, particularly speakers of low-incidence languages, for the two-generation programs it supports. We heard from a few programs that they had themselves, with limited resources, translated extensive materials, including handbooks, into minority languages like Somali or Hmong, but that these hadn't been shared with other Head Start programs, so that each individual program was essentially reinventing the wheel at great time and financial cost. And given that so many programs are now located in very diverse and multilingual contexts, regional coordination and regional provision of resources can reduce costs for these services and improve programs' linguistic and cultural competence. This is otherwise an issue that is placing a huge burden on small local programs that are truly going above and beyond to try and meet their beneficiaries' needs. And then finally, going back to what I was saying earlier, two-generation approaches with flexible service structures allow local programs and communities to tailor services to the needs of immigrant families whose challenges are often multifaceted and require intensive or tailored services. I mentioned in talking about our interview findings that Promise Neighborhoods, for example, appears to be among the most responsive of two-generation programs at the federal or local level, in that they can identify gaps through a data-driven approach and then respond comprehensively to unique community needs in a real two-generation strategy that takes a cradle-to-career approach. The community schools model is also highly non-prescriptive in its approach, and so with that flexibility can potentially more effectively and efficiently meet changing community needs. So further research into programs using these models could be particularly useful as they aim to expand into new areas. New York City, for example, has embraced the community schools model locally, and continued support and expansion of initiatives like these is likely to benefit immigrant and refugee communities. And with that, I'll go ahead and hand it back to Margie.
Great. Thank you, Maki. Throughout the report, we've woven in a discussion about the role of parent-focused English programs, because as you see both from the data that comes out of the socio-demographic analysis that we conducted, and also a lot of the interviews that we did with programs that are successfully serving immigrant and refugee parents. It was very clear both that it's a need that jumps out from the data, and it's something, and it's a service that so many of the successful programs had figured out how to provide, this meeting the need of parents to learn more about the schools that their children were going into, to develop, in some cases, family literacy practices, both building their parents' own literacy and the children's literacy, and lots of reading in the home and things like that, and also to get more engaged in some of the parenting skills, so use of very complex language with their children, et cetera, that's often conveyed in some of these parent-focused adult education programs. And so one of the challenges that many of the successful programs are reporting is that very often, not in all cases, but that very often those programs were under threat now because of the implementation of new provisions under what's known as the Workforce Innovation and Opportunity Act, otherwise known as WIOA, because under that law, one key title of it provides workforce training services to states and localities around the country. The second title is essentially the adult education law for the country, and that is the source of funding for the federal-state partnership that provides adult education services, and that's where adult English language acquisition classes are generally funded from, and traditionally family-focused programs were a key part of the money, of the ways in which that program money was used. Now, under the new law, all adult education programs funded have to meet the same performance accountability requirements that workforce training programs need to meet. And so those requirements, they're outlined in the report, but they're very employer-focused, not surprisingly. So it's things like what is your the participant in your program's earnings? Are they employed after exit from your program? Are they at the second quarter and the fourth quarter? What kind of earnings are they making? What's your employer satisfaction rating from the services that you provided? And also how many of them made a post-secondary transition. So because of the new mandatory nature of those program requirements, many of these on-ramp or threshold services for parents of young children suddenly feel like they suddenly are being crowded out, or they're less attractive for funding under their state systems because of the fear that they're going to make the state look bad and ultimately have the state lose money because they will not be able to meet those other requirements. And in the report, we sort of reach back, and because you can see very clearly in the data profile that these are, if you're a parent of young children and you have 2 or 3 children at home and you're looking for a parent-focused program, well, you're home with your children and you're not actually out in the workforce. So it's not even part of your goals as a program participant to be entering such a program. And so this is a real dilemma for those who are in the early childhood field and who have wanted and have relied for quite some time now on having programs that are able to meet the early childhood field's need through these adult education services, but now the adult education field is being pushed into much more of an employment-focused frame. And so it is one of the key challenges. The one that was talked about most, I would have to say, from all the programs we spoke with, that this on-ramp into the trajectory, the stages of 2-generation services that the field very much hopes for, that it's really as if the pathway in for so many immigrant and refugee families has really been destabilized with the passage of this new law. So we talk about a number of opportunities for how to address that in the report. And one of these are all just emerging because the new workforce law, even though it was passed in 2014, is only actively being implemented now at the state level because it took some time for there to be federal regulations, et cetera, states having to figure out how to create their plans in line with the new law, have them be reviewed at the federal level, et cetera. So one interesting thing that's happened in at least a few states is there is more of a conversation now, since states provide a significant match very often for the federal funds. They're only required to provide 25 cents on the dollar. States like New York, however, that match at a much higher level, their federal dollars have begun to pull some of their federal match dollars out of the federal system and leave those monies available to still continue to do the sorts of services that they think are important, but that really don't fit under the new federal law. And so a key example of that would be something like family literacy services that a state might believe with its early childhood hat on are critical for having their early childhood investments pay off, but that might hurt them if they're funding it in the context of the federal workforce system, because there it would look like a program that wasn't achieving the goals of that system, even though it's meant to be part of that system. So we think that looking and monitoring, analyzing state innovation as the implementation of the law moves forward is one of the important things for the two-generation field to do if it intends to more proportionately serve immigrant and refugee parents of young children, since this threshold service is so important. Obviously, if it were possible to expand federal support for programs that address immigrant parents' English language literacy system navigation needs, since the federal government is responsible for immigration and refugee policy, having the federal government be a better partner with states in terms of meeting the needs of immigrant and refugee parents would be appreciated, I think it's fair to say, from many states. But one of the ways that the federal government could do that, if not in a more generic way, would be to look at the refugee program and consider, given the discretionary nature of the funds within the program, the fact that some of those funds can be reallocated for different purposes, that perhaps there are better partnerships to be had between states and the federal government related to refugee services, for at least trying to meet the needs of those parents to make sure that both the children and the parents get a full orientation to the design of systems and services in the U.S. and to understanding a lot of the parenting practices and literacy practices that could make sure that their children are kindergarten ready and really positioned to succeed in the U.S. education system, at the same time introducing parents to many of the opportunities that they could have to fill gaps they may have in their education and to advance in their education and training. So I think with that, we will move to questions that have come in from all of you. I encourage you to continue to write in. We appreciate the questions that we already have. And Maki, I'll pitch a few of the questions to you first. One of them was that you had spoken about pathway programs for the early childhood workforce. And the question was, are there pathway programs that were part of this, that were being used by some of the programs that were part of this study?
So as part of this study, we did look at a number of programs who, as I mentioned, were offering grow your own initiatives. And in some cases, for example, PICA Head Start had partnered directly with local community colleges in order to provide the kinds of support that their parents needed in order to have ESL and adult basic education alongside some of the degree requirements. None that were directly, had really created a pathway program that was formally used by folks outside of that program. But we do have a forthcoming report where we'll go into much greater detail about some of the types of programs that are out there that have been really successful. iBest in Washington State is a model that's often touted. Miami-Dade College in Florida also has a really interesting bilingual model that they're using to provide a broader pathway for their early childhood workforce. And so that information will be forthcoming.
Great, thank you. And then another question was, did we look at issues affecting unauthorized families, and were they eligible for services from the programs we studied?
So many of the programs that we were looking at did serve, I think, a fairly large proportion of unauthorized families, and this was an issue that was raised, for example, by home visiting programs, as well as, for example, Avance, who does a really good job of reaching those families who are the most isolated. Sorry, was there a second part to that question?
Yes, it was both, did we look at issues affecting unauthorized families, and were they eligible for services from the programs we studied? Yes,
and so for the most part, the majority of programs that we looked at, actually all the programs that we looked at, did not have enrollment procedures that excluded unauthorized families. However, for home visiting programs that are national models but that are implemented locally, some state laws did have enrollment procedures that would have excluded those families. However, none of these local programs were the ones that we had included in our study.
Great. All right, and then not surprisingly, a lot of you were asking, given, will funding sources be affected by the new administration, or if we're expecting that there might be some federal level cuts to domestic programs, are there non-federal sources of support? So Maki, I wonder, could you just start by talking about some of the programs that had non-federal funding or were significantly non-federal funded?
Sure. So most of the programs that we looked at really did blend and weave together a variety of funding sources. And I will say that while many of the models that we looked at were federal, I was, for example, talking about New York City embracing the community schools model. Under Mayor de Blasio, they're going to open 100 new community schools at the city level. And we also saw some innovative use of funding. For example, BRIA was a program that used charter school funding, and they were really touting the fact that that was really a flexible source that allowed them to really meet the needs of the families that they were serving. In general, I think the most robust programs had realized that in order to really persist through different administrations and through different funding climates, and especially those who had started as, for example, Even Start programs, which, that funding was lost several years ago. As a result, I think as a survival mode factor, that they were constantly seeking new private and public sources of funding, local funding, private philanthropies. Really, you can see in a chart in the report, it covers a wide gamut of different sources. But I think that's exactly right, that Promised Neighborhoods, for example, which is one of the most promising programs that we looked at, is likely to be threatened under this new administration.
Great. So I'll just add to that and sort of weave in a few of the other questions that are coming in. First of all, we want to say clearly that the WIOA Title II adult education funds do not, in federal law, have work authorization or immigration status restrictions placed on them. However, several states have acted to attempt to, and in some cases actually have implemented their own restrictions on them. But for the most part, these are services that the federal law does not require that there be any status restrictions. And then it might be getting too off into the weeds to talk about how the Social Security number, the use of Social Security numbers that is sought under WIOA is affecting the ability, or is creating a lot of concerns and expenses for states. That could perhaps be an offline conversation for those of you who are more interested in that. I wanted to return to the funding issue, though, because a number of you were asking to hear more about the state-only fund issue. So what I was referring to is that states are required to match the federal dollars at least 25 cents on the dollar. And many states are providing $8, $9 more for each dollar they receive from the federal government. They're only allowed to reduce the amount of money that they have previously matched the federal dollars with by a certain amount each year. And so that is, some people were asking me, what exactly did New York do? So that is what New York State has begun to do, is to essentially pull out some of the money that it previously had matched the federal dollars with, pull them out of the system, but leave them available still to meet as part of the state's adult education system, but it's simply not under the umbrella or the performance requirements anymore of the federal system. And so that both relieves the states of some of the onerous tracking requirements, for example, for individuals without a Social Security number with those particular funds, and it also allows more flexibility to serve individuals that might, in a sense, handicap the state, penalize it in terms of performance accountability measures and the like under the law because they're not able to meet some of the workforce outcomes. And then I want to also note that when Maki was talking about adult charter schools and the fact that BREA was an adult charter school and not therefore using federal Title II dollars, for example, for the bulk of its programs, that there is going to be that there is a focus on that model and an attempt to have more folks who are in states that have that may have charter school dollars available, to have them be to have it be possible to use those for adult school models. So there's a meeting that'll be happening soon in Washington, D.C. around that, sponsored by the Office of Career and Technical Education, and maybe some additional resources coming out around that. So happy to share more of that with some of you who are interested. In the meantime, Maki, let me just ask you, there was a question about whether we looked at issues, or either issues in the field work or in our analysis based on the age of parents. And also, what about, is there anything that we'd have to say about two-generation programs for parents in the middle or high school grades?
I think I saw the question that was asking about whether the disparity in employment rates, or those seeking employment, was likely affected by younger mothers. And I will say that we did not do a formal analysis that broke down parents by age bands. However, it's doubtful that teen parents or young parents who are foreign-born would explain the disparity in mothers who are seeking employment, particularly since, in general, immigrant children are much more likely to live in two-parent households. That the disparity between teen mothers who are immigrants and teen mothers who are native-born isn't likely to explain that difference. But that wasn't a key point of our analysis. And then in terms of programs that are also serving parents of middle and high school students, I think, as part of our trying to identify which programs to study, that we did run across several that had promising practices in this area. And some of the programs that we looked at don't limit their services to parents of young children. the community schools model at Oakland Unified, for example, extends into their high school years. But we really focused on early childhood primarily because of the outsized impact that we think that it can have on immigrant families and families in general. But there's certainly room to explore in that area as well.
Great. And then we had a few questions that I would maybe cluster together that were talking about the sort of the costs of programs and how to afford the cost of childcare, for example. That I know that a number of you who have been running programs for a while, that one of the things that makes family literacy programs, for example, sometimes stick out like a sore thumb in a larger citywide context where adult education programs are serving different kinds of populations, because family literacy programs often try to they're serving both the parent and the child, and in serving the child, they need either child care or child-focused programming. That when compared to other adult education programs, it's a higher cost model, and I think that gets to back to the question about what are the other ways that there might be to expand the necessary sorts of programs in this space, and not have it be through simply the federal WIOA system. And so that is one of the conversations that we were hoping that the report would prompt, that actually it's interesting to us at MPI that we have a foot in the early childhood field and a foot in the adult education field, and that for all the talk about how to braid and weave together funding to meet family needs better, that we really so often, including in the field work for this report, see adult education programs who really would love to be able to partner with folks who are in the early childhood field to better meet the needs of parents and families that they're serving, just as there are many programs in the early childhood field that find that they really can't work well with immigrant and refugee parents because they don't have appropriate program models for helping to build the literacy skills and have a more parent-focused model. And so one of our hopes is that by raising up the demographic change and putting this data into the hands of state-level system administrators and stakeholders in the two-generation field, that perhaps some of those models could be anticipated, both as there are different and new investments in the early childhood field at the state level, and also as adult educators start to think more about how do they finance the models that they know are needed, knowing that they don't fit as well in this new era of WIOA. So with that, as we're, I'm being pointed to a few more questions that maybe we can hopefully get to pretty quickly. So Maki, could you talk about were there any of the programs we studied providing support with mental health services or helping families meet their health insurance needs?
Yes, so one of the key findings that I didn't discuss in the webinar, just for time purposes, was the fact that, I did talk about how taking a case management approach and really meeting all of the needs of the families was identified as a key promising practice. And all of the programs that we looked at either had on-site health provisions or partnered very closely, beyond just referrals really, but having close kind of two-way relationships with community organizations that could provide mental health counseling, particularly in the case of refugee families, but also counseling in terms of legal issues and providing health insurance. So yes, the importance of wraparound services and really addressing every aspect of a family's need, really I can't stress enough.
Great. Thanks, Maki. So we have a few refugee questions, refugee-related questions that I'll try and answer pretty quickly. One was, given that refugees with professional experience in education often have a difficult time having their, having that experience, the experience or the education that they have translate into the U.S. Job market. And so I would say, yes, that is certainly an issue that we're very conscious of, and part of the question was, how did we ascertain someone's level of education? And we did that because we did that through the reporting that individuals provide to as the American Community Survey is administered by the Census Bureau. So that's a self-report, but it is one of the issues that you'll see it in many of the tables where we point out the level of education of all foreign-born individuals. You'll be able to get that soon for the top 30 states. And you can also find other resources on MPI's website that look much more deeply at issues for those who have higher education and training. Very often, in addition to the barriers they might face in having their credentials recognized, there often aren't adult English language classes in sufficient supply at higher levels of English, what would be levels 5, 6, and many argue that there's a level 7, 8 that's not recognized or not well served almost anywhere in the country that would give individuals professional level English skills as opposed to simply the level that would allow them to navigate everyday life. Also, there was a question about whether the Office of Refugee Resettlement funds under the School Impact Grant can be used for family engagement and parenting support around literacy. And I would say that we've mainly seen those funds be used in terms of more of a K-12 model where they're used to be supportive of parents of schools that are working with large numbers of refugee families at the K-12 system level, and that is one of the issues in terms of providing sufficient intensity services for refugees with young children, that they would be program models that would require much more than the sort of light touch that many refugee families get in just the first few months of resettlement, and that instead what we would argue for is a more extended model that truly works with those families to build the parents' knowledge of the U.S. education system, child development issues, and all the things that are very much I think part of the thinking among middle-class American families in terms of what it takes for their children to be kindergarten ready, trying to pass more of that along to families that are new to the U.S. and may not understand both some of the parenting practices and the literacy development practices that are more commonly used. So with that, I'm sorry. I know we still have a few questions we didn't get to, but we'll definitely get back to those of you we didn't answer through the call just via email. But again, thank you. So many of you are working on the front lines, and we appreciate your interest in this work that we've been involved in, and all the work that you all are involved in to promote the successful integration of immigrants and their families. And we hope that this report is useful to the two-generation field in terms of trying to figure out how to more proportionately and effectively serve immigrant and refugee families. Thanks so much. Have a great rest of the day.
For more information on MPI's National Center on Immigrant Integration Policy, please visit migrationpolicy.org/integration.